Swimmer's ear is the colloquial name for acute otitis externa, which is the less colloquial but real name for it. If you've never had it, it can be a bit of a problem. It's an infection of the outer ear, and with me now is Dr. Marc Eisen with tips on how to prevent it and also a basic primer on what swimmer's ear is. Good to see you again, sir.
Tim, likewise.
Glad to have you here. Please tell us, what is it? How does it differ from other ear infections?
Swimmer's ear is an infection in the ear canal itself. So this is different than otitis media, which is what kids typically get when they get colds. It's on the ear canal side of the ear. So water exposure to the ear canal skin is not ideal. And if you get enough water exposure and you're prone to it, what happens is the skin itself gets infected. And it results in pain, drainage, and the sensation of fullness. And typically, if that happens, and it's not that common, but it definitely happens in the summer with water exposure.
Yeah, I was going to say, people are in pools all the time. Is there anything people are doing in the pools themselves that might lead to more of that water exposure in the ear?
The good news is that most human ears don't get infected when they're exposed to water. If you're predisposed to it, it's because of the chronic water exposure and the skin just doesn't like it. So there's some strategies. You can not swim. You can do some rubbing alcohol and vinegar after you swim, and that can dry out the ear. It's a lot of it's water exposure and the wetness of the skin that causes the problem.
Okay. So you mentioned, what, it was vinegar and...
vinegar and rubbing alcohol, which is a great combination, 50-50.
How exactly do you apply that?
You have to drop it in. So you get a medicine dropper and a couple drops in the ear after you swim. And this, again, this is just if you're prone to it. And it's a nice way to dry out the ear, to dehydrate it.
I was just thinking of this in offhand, and there may not be a good answer to this question because I was just telling you before, I was trying to teach my 4-year-old how to swim, and he's afraid to put his ears in the water coming off an ear infection. And I was trying to tell him, look, water doesn't always really get in there. I think that just because there's the ear, there's an air pocket within the ear that's probably pushing it out.
You're trying to reason with your 4-year-old.
Yes, right. Might as well be trying to reason with my cat.
And to address that, though, most kid ear infections, that's otitis media, which is on the other side of the eardrum, but the stress of thinking that you might get another ear infection, even if it's not going to happen with water exposure, and you can understand how they can be uncomfortable.
So when you do get swimmer's ear, we talked about prevention. What do you do for treatment? Is it going to require antibiotics?
It usually requires drops. The problem is you don't always know if you have this, so ear pain, drainage, could be other problems also. So you really should probably be seen by a physician, and the drops are the way to solve the problem, but sometimes it's a different problem. So you need to know the problem first.
There you go, and that's why you go to an expert like Dr. Eisen. Thank you so much for joining us today. Good to see you again.